Question 1. The evaluation methodology shows that a theriogenologist is considering the implementation of a novel somatic cell nuclear transfer (SCNT) protocol for elite livestock breeding. The goal is to rapidly propagate genetically superior individuals. What is the most appropriate next step in optimizing this process within the U.S. regulatory framework and ethical considerations for animal biotechnology? Option A. Immediately proceed with pilot trials using the novel SCNT protocol on a small cohort of animals, assuming the technique's general principles are sound based on its application in other species. Option B. Rely on anecdotal reports from international colleagues who have achieved success with similar SCNT protocols and begin implementation in the practice. Option C. Conduct a comprehensive review of peer-reviewed literature on SCNT in the target species, consult with established SCNT research groups, and thoroughly investigate relevant FDA and USDA guidelines for animal cloning and genetic modification. Option D. Focus solely on optimizing the laboratory aspects of the SCNT protocol, such as media composition and incubation times, without initial consideration for regulatory approval or broader ethical implications. Correct answer is C. Conduct a comprehensive review of peer-reviewed literature on SCNT in the target species, consult with established SCNT research groups, and thoroughly investigate relevant FDA and USDA guidelines for animal cloning and genetic modification. Explanation. The evaluation methodology shows a critical juncture in applying advanced biotechnology for reproductive efficiency in a theriogenology practice. The professional challenge lies in balancing the potential benefits of novel biotechnologies with established ethical guidelines, regulatory compliance, and the welfare of the animals involved. This scenario demands a deep understanding of the scientific principles, the legal framework governing animal reproduction and biotechnology in the U.S., and the ethical considerations inherent in manipulating reproductive processes. Careful judgment is required to select the most appropriate and responsible approach. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation that aligns with the principles of responsible innovation and regulatory oversight. This involves a thorough review of existing scientific literature, consultation with experts, and a clear understanding of the regulatory landscape, including any specific guidelines from relevant U.S. agencies or professional bodies that govern the use of such biotechnologies in veterinary medicine. This ensures that any application is scientifically sound, ethically defensible, and compliant with all applicable laws and regulations, ultimately safeguarding animal welfare and maintaining professional integrity. An incorrect approach that bypasses rigorous scientific validation and regulatory review is professionally unacceptable. Such an approach risks the welfare of the animals by exposing them to unproven or potentially harmful techniques. It also constitutes a failure to adhere to the ethical obligations of a theriogenologist to act in the best interest of the animal and to uphold professional standards. Furthermore, it may violate U.S. regulations pertaining to the use of novel biotechnologies in animal reproduction, potentially leading to legal repercussions and damage to the professional's reputation. Another incorrect approach that relies solely on anecdotal evidence or the perceived success of a technique in a different species or context without specific validation for the target species and application is also professionally unsound. This demonstrates a lack of due diligence and a disregard for the scientific method, which is fundamental to veterinary practice. It fails to account for species-specific biological differences and the potential for unforeseen consequences, thereby compromising animal welfare and professional responsibility. The professional reasoning process for similar situations should involve a structured approach. First, clearly define the reproductive goal and the biotechnological tool being considered. Second, conduct a comprehensive literature search to assess the current state of scientific knowledge regarding the technique's efficacy, safety, and applicability to the specific species and context. Third, identify and consult with relevant experts in the field. Fourth, thoroughly investigate the applicable U.S. regulatory framework, including any guidelines from the FDA, USDA, or relevant state veterinary boards. Fifth, critically evaluate the ethical implications, particularly concerning animal welfare, potential for genetic manipulation, and informed consent, where applicable. Finally, make a decision based on the synthesis of scientific evidence, regulatory compliance, ethical considerations, and the best interests of the animal. Question 2. The assessment process reveals a stallion exhibiting reduced sperm motility and a higher than acceptable percentage of morphologically abnormal sperm, particularly in the midpiece and tail regions, despite normal testicular palpation and testosterone levels. Considering the critical role of the epididymis in sperm maturation and storage, which of the following diagnostic and management approaches best reflects current best practices for evaluating and addressing potential epididymal dysfunction in this stallion? Option A. Focus solely on improving the mare's reproductive health, as poor conception rates can sometimes be attributed to factors other than the stallion's semen quality. Option B. Perform a detailed transrectal ultrasonographic examination of the epididymis, focusing on the caput, corpus, and cauda, and correlate any findings with serial semen analyses to monitor changes in sperm parameters over time. Option C. Conclude that the stallion is experiencing age-related decline in sperm quality and recommend reduced breeding frequency without further specific investigation. Option D. Initiate empirical treatment with broad-spectrum antibiotics and anti-inflammatory medications, assuming a subclinical inflammatory process within the reproductive tract. The correct answer is B. Perform a detailed transrectal ultrasonographic examination of the epididymis, focusing on the caput, corpus, and cauda, and correlate any findings with serial semen analyses to monitor changes in sperm parameters over time. Explanation. The assessment process reveals a stallion with suboptimal sperm motility and morphology, raising concerns about epididymal function and sperm maturation. This scenario is professionally challenging because it requires a thorough understanding of the physiological processes occurring within the epididymis, the impact of various factors on sperm maturation, and the application of diagnostic techniques to pinpoint the underlying cause. The veterinarian must differentiate between primary testicular issues and problems related to sperm transit and maturation within the epididymis, which directly impacts breeding soundness and reproductive potential. The correct approach represents best professional practice because it systematically evaluates the stallion's reproductive health, focusing on the epididymis as a critical site for sperm maturation and storage. This involves a comprehensive physical examination, detailed semen analysis, and potentially advanced diagnostic imaging or hormonal assays. By correlating findings with known physiological processes of sperm maturation in the epididymis, the veterinarian can formulate an accurate diagnosis and recommend appropriate management strategies. This aligns with the DACT commitment to advancing theriogenology through evidence-based practice and ethical conduct, ensuring the welfare of the animal and the integrity of breeding programs. An incorrect approach that solely focuses on immediate treatment without a thorough diagnostic workup fails to address the root cause of the suboptimal sperm parameters. This could lead to ineffective treatments, wasted resources, and potentially prolonged reproductive inefficiency for the stallion. Ethically, it represents a failure to provide competent care and to act in the best interest of the animal. Another incorrect approach might be to attribute the findings solely to age or general infertility, without specific investigation into the epididymis. This overlooks the specialized role of the epididymis in sperm maturation and the potential for specific pathologies within this organ that can be identified and managed. Such an approach neglects the detailed knowledge expected of a DACT diplomate regarding the nuances of male reproductive physiology. A further incorrect approach could involve making definitive diagnoses based on limited or superficial examination, without considering the dynamic nature of sperm maturation and storage within the epididymis. This demonstrates a lack of critical analysis and a failure to apply the depth of knowledge required for advanced reproductive practice. The professional decision-making process for similar situations should involve a structured approach. 1. Comprehensive history and physical examination, paying close attention to the reproductive tract. 2. Detailed semen evaluation, including motility, morphology, concentration, and viability, with specific attention to patterns indicative of epididymal dysfunction. 3. Consideration of the physiological stages of sperm maturation within the epididymis, caput, corpus, cauda, and how these stages might be affected. 4. Application of advanced diagnostic tools as indicated, such as transrectal ultrasonography of the epididymis and testes, hormonal assays, or even epididymal aspiration if warranted and ethically permissible. 5. Integration of all findings to formulate a differential diagnosis and a targeted treatment or management plan. 6. Ongoing monitoring and reevaluation to assess the efficacy of interventions. Question 3. Operational review demonstrates that a client wishes to administer a combination of exogenous estrogens, progesterone, and androgens to a mare with a history of irregular estrus cycles in an attempt to synchronize her cycles for a specific breeding window. The client has read about such protocols in non-peer-reviewed forums and believes this will improve conception rates. As the attending Theriogenologist, what is the most ethically and professionally sound course of action? Option A. Immediately administer the requested hormonal combination as per the client's instructions to maintain client satisfaction and avoid conflict. Option B. Discuss the lack of established scientific evidence and documented safety/efficacy for such a protocol in mares. Explain the potential risks of hormonal disruption, and recommend further diagnostic evaluation or alternative evidence-based breeding management strategies. Option C. Refuse to discuss the request further and inform the client that such interventions are not within the scope of standard veterinary practice. Option D. Proceed with the hormonal administration based on the client's request, assuming the client understands and accepts any potential risks without detailed discussion or documentation. The correct answer is B. Discuss the lack of established scientific evidence and documented safety/efficacy for such a protocol in mares. Explain the potential risks of hormonal disruption, and recommend further diagnostic evaluation or alternative evidence-based breeding management strategies. Explanation. Scenario analysis. This scenario presents an ethical dilemma for a theriogenologist regarding the off-label use of exogenous hormones in a breeding program. The challenge lies in balancing the client's desire for a specific outcome with the veterinarian's responsibility to uphold animal welfare, adhere to professional standards, and comply with regulatory guidelines concerning drug use. The potential for misuse, unintended consequences on reproductive health, and the lack of robust scientific evidence for the proposed protocol create a complex decision-making environment. Correct approach analysis. The correct approach involves a thorough discussion with the client, emphasizing the lack of established protocols and potential risks associated with the proposed off-label use of estrogens, progesterone, and androgens. This approach prioritizes informed consent, animal welfare, and adherence to the principle of using medications judiciously and only when scientifically justified. It aligns with the ethical obligations of a veterinarian to act in the best interest of the animal and to practice evidence-based medicine. The theriogenologist should explain that while these hormones play critical roles in reproduction, their exogenous administration in this context lacks sufficient data to predict efficacy or safety and could potentially disrupt the animal's natural hormonal balance, leading to adverse reproductive outcomes or long-term health issues. Recommending further diagnostic workup or exploring alternative, evidence-based breeding strategies would be the most responsible course of action. Incorrect approaches analysis. One incorrect approach would be to immediately agree to the client's request without further investigation or discussion. This fails to uphold the veterinarian's duty of care and could lead to animal harm. It bypasses the ethical imperative to ensure that any treatment or intervention is in the animal's best interest and is supported by scientific evidence. This approach also neglects the importance of informed consent, as the client would not be fully aware of the potential risks and uncertainties. Another incorrect approach would be to dismiss the client's request outright without providing a reasoned explanation or offering alternatives. While the request may be based on anecdotal evidence or a misunderstanding of hormonal physiology, a professional veterinarian should engage in a dialogue, educate the client, and explore the underlying reasons for their request. This approach could damage the client-veterinarian relationship and fail to address the client's underlying concerns or goals. A third incorrect approach would be to proceed with the off-label use based solely on the client's insistence, without documenting the rationale, risks, and client consent thoroughly. This creates significant professional liability and ethical concerns. It suggests a lack of professional judgment and a failure to adhere to best practices in veterinary medicine, which mandate careful consideration of drug efficacy, safety, and regulatory compliance, especially in off-label scenarios. Professional reasoning. Professionals should approach such situations by first understanding the client's objectives and the rationale behind their proposed intervention. This should be followed by a comprehensive review of available scientific literature and established veterinary guidelines. If the proposed intervention is off-label or lacks strong evidence, the veterinarian must clearly communicate the uncertainties, potential risks, and benefits to the client. The decision-making process should prioritize animal welfare, ethical considerations, and professional responsibility, leading to a collaborative plan that is both scientifically sound and ethically defensible. Question 4. Process analysis reveals a 5-year-old quarter horse stallion, a highly valued breeding animal, presented with a history of difficulty extending his penis during breeding attempts and occasional swelling of the glans penis. The owner is concerned about his fertility and potential for future breeding soundness. You are tasked with evaluating the stallion's penile structure and function. Which of the following diagnostic and management approaches best aligns with theriogenological best practices and ethical considerations for a breeding stallion? Option A. Perform a thorough physical examination of the penis, including palpation of the corpus cavernosum and spongiosum, visual inspection for any lesions or abnormalities, and assess the degree of preputial retraction and penile extension. If no gross abnormalities are immediately apparent, recommend a period of rest and observation, followed by a breeding soundness evaluation. Option B. Immediately recommend surgical intervention to address potential adhesions or strictures within the prepuce, without further diagnostic imaging or functional assessment, to expedite the stallion's return to breeding. Option C. Advise the owner that such issues are common in older stallions and suggest a reduced breeding schedule, focusing on observation for any signs of infection without further diagnostic workup. Option D. Recommend immediate euthanasia due to the potential for chronic reproductive impairment and the inherent risks associated with breeding stallions exhibiting such symptoms. The correct answer is A. Perform a thorough physical examination of the penis, including palpation of the corpus cavernosum and spongiosum, visual inspection for any lesions or abnormalities, and assess the degree of preputial retraction and penile extension. If no gross abnormalities are immediately apparent, recommend a period of rest and observation, followed by a breeding soundness evaluation. Explanation. This scenario presents a professionally challenging situation due to the inherent complexity of diagnosing and managing penile abnormalities in a breeding stallion, requiring a thorough understanding of normal anatomy and physiology to identify deviations. The challenge is amplified by the need to balance the diagnostic process with the economic and reproductive implications for the owner, necessitating a judicious and evidence-based approach. Careful judgment is required to differentiate between congenital defects, acquired injuries, and functional impairments that could affect fertility. The correct approach represents best professional practice because it prioritizes a systematic, diagnostic investigation aligned with established veterinary principles and ethical considerations for animal welfare and responsible breeding. This involves a comprehensive physical examination, including palpation and visual inspection of the penis, followed by targeted diagnostic imaging and potentially functional assessments. Such an approach ensures that the diagnosis is accurate, leading to appropriate treatment recommendations that consider the stallion's reproductive potential and overall health, thereby upholding the veterinarian's duty of care and professional integrity. An incorrect approach that relies solely on empirical treatment without a definitive diagnosis would represent a significant regulatory and ethical failure. This bypasses the fundamental veterinary principle of diagnosis before treatment, potentially leading to ineffective or even harmful interventions. Ethically, it fails to provide the owner with informed consent based on a clear understanding of the problem and its prognosis. From a regulatory standpoint, it could be construed as practicing veterinary medicine without due diligence, potentially violating standards of care expected of a diplomate of the American College of Theriogenologists. Another incorrect approach, such as recommending immediate euthanasia based on a preliminary observation without exploring all diagnostic and therapeutic options, would be ethically indefensible and likely violate animal welfare regulations. This prematurely dismisses the potential for successful management and recovery, failing to act in the best interest of the animal. It also disregards the economic and emotional investment of the owner. A third incorrect approach, focusing exclusively on cosmetic appearance without assessing functional capacity for breeding, would be professionally inadequate. While aesthetics may be a consideration, the primary concern for a breeding stallion is reproductive soundness. Neglecting functional assessment would fail to address the core issue relevant to the stallion's purpose and the owner's objectives, demonstrating a lack of comprehensive theriogenological expertise. The professional decision-making process for similar situations should involve a structured approach. 1. Thoroughly gather history from the owner. 2. Conduct a complete physical and reproductive examination, including detailed examination of the penis. 3. Formulate a differential diagnosis list based on findings. 4. Select appropriate diagnostic tests to confirm or rule out differentials, considering the stallion's intended use. 5. Discuss diagnostic findings, prognosis, and treatment options with the owner, ensuring informed consent. 6. Implement a treatment plan based on evidence-based medicine and ethical considerations. 7. Monitor progress and adjust treatment as necessary. Question 5. The risk matrix shows a high probability of reproductive loss in a valuable 4-year-old Angus bull presenting with acute scrotal swelling, pain on palpation of the left testicle, and a mild fever. The differential diagnoses include bacterial orchitis and epididymitis. Given the bull's breeding value, what is the most appropriate initial diagnostic and therapeutic approach to maximize the chances of preserving reproductive soundness while adhering to veterinary best practices? Option A. Administer a course of anti-inflammatory medication and rest, advising the owner to reevaluate the bull's breeding soundness in 60 days, without pursuing specific diagnostic tests for infectious agents. Option B. Rely on the owner's previous experience with similar cases and administer a commonly used antibiotic based on anecdotal recommendations from other producers, without performing diagnostic tests or a detailed physical examination. Option C. Perform a thorough physical examination, including careful palpation of both testes and epididymides, collect samples for semen evaluation and potentially bacterial culture and sensitivity testing, and initiate empirical treatment with a broad-spectrum antibiotic known to penetrate testicular tissue, while monitoring for clinical response and potential complications. Option D. Immediately recommend culling the bull due to the high risk of permanent infertility and the potential for disease transmission within the herd, without further diagnostic investigation or therapeutic intervention. Correct answer is C. Perform a thorough physical examination, including careful palpation of both testes and epididymides, collect samples for semen evaluation and potentially bacterial culture and sensitivity testing, and initiate empirical treatment with a broad-spectrum antibiotic known to penetrate testicular tissue, while monitoring for clinical response and potential complications. Explanation. Scenario analysis. This scenario presents a veterinarian with a challenging diagnostic and therapeutic dilemma involving a valuable breeding bull exhibiting signs of orchitis and epididymitis. The professional challenge lies in balancing the immediate need for treatment to preserve reproductive potential with the economic implications of potential infertility and the regulatory requirements surrounding disease reporting and animal welfare. The veterinarian must consider the diagnostic limitations, the efficacy and potential side effects of various treatments, and the long-term implications for the herd and the owner's business, all within the framework of established veterinary practice guidelines and regulatory compliance. Correct approach analysis. The correct approach emphasizes a systematic diagnostic process, including thorough physical examination, palpation, and potentially advanced imaging or sampling, followed by judicious antibiotic selection based on likely pathogens and susceptibility patterns. This aligns with best professional practice by prioritizing accurate diagnosis and targeted treatment, minimizing the risk of antibiotic resistance and unnecessary drug exposure. It also reflects ethical obligations to provide competent care and uphold animal welfare. Furthermore, it implicitly acknowledges the need to adhere to any relevant state or federal regulations regarding the diagnosis and treatment of reproductive diseases in livestock, including potential reporting requirements if a zoonotic or reportable disease is suspected. Incorrect approaches analysis. One incorrect approach involves immediate, empirical treatment with a broad-spectrum antibiotic without a thorough diagnostic workup. This fails to establish a definitive diagnosis, potentially leading to ineffective treatment, prolonged illness, and the development of antibiotic resistance. Ethically, it represents a failure to provide the highest standard of care and could be considered negligent if it compromises the animal's recovery or reproductive future. It also bypasses the opportunity to identify specific pathogens, which might be relevant for herd health management or regulatory reporting. Another incorrect approach is to recommend immediate culling of the bull, without exploring all viable treatment options. While culling might be a consideration in severe or untreatable cases, it represents a premature decision that disregards the potential for recovery and the economic value of the breeding animal. This approach fails to meet the ethical obligation to preserve animal life and welfare when possible, and may not be justifiable from a veterinary perspective without a comprehensive assessment of the prognosis and treatment feasibility. It also overlooks the potential for successful treatment and return to breeding soundness. A third incorrect approach is to rely solely on anecdotal evidence or recommendations from other producers regarding treatment protocols. Veterinary medicine is a science-based profession, and treatment decisions must be grounded in current scientific knowledge, diagnostic findings, and established therapeutic guidelines. Relying on unsubstantiated advice can lead to inappropriate treatment, adverse drug reactions, and a failure to meet professional standards. This approach also neglects the veterinarian's responsibility to provide evidence-based care and to comply with regulatory frameworks that often dictate appropriate diagnostic and therapeutic pathways for specific conditions. Professional reasoning. Professionals should approach such cases by first gathering a comprehensive history and performing a thorough physical examination. This should be followed by a systematic diagnostic plan tailored to the presenting signs and the species. Treatment decisions should be based on evidence-based medicine, considering the likely causative agents, antimicrobial susceptibility, potential for drug residues, and the animal's reproductive status. Throughout the process, veterinarians must remain cognizant of their ethical obligations to the animal and the client, as well as any applicable regulatory requirements for disease diagnosis, treatment, and reporting. Open communication with the client regarding diagnostic options, treatment prognosis, and associated costs is paramount. Question 6. The audit findings indicate a pattern of inconsistent diagnostic workups for accessory sex gland abnormalities in stallions presented for pre-purchase examinations. Which of the following approaches best reflects a risk-based, evidence-driven methodology for evaluating these findings and guiding subsequent diagnostic and therapeutic decisions? Option A. Classify all accessory sex gland abnormalities as minor findings and proceed with the pre-purchase examination without further investigation, assuming they will not impact fertility or future breeding potential. Option B. Initiate empirical broad-spectrum antimicrobial therapy for all stallions exhibiting any deviation from normal accessory sex gland palpation or ultrasonographic findings, regardless of specific clinical signs or culture results. Option C. Immediately recommend elective surgical intervention for any stallion with ultrasonographic evidence of prostatic cysts or seminal vesiculitis, without prior confirmation of clinical significance or impact on semen quality. Option D. Conduct a thorough physical examination, including palpation and ultrasonography of the accessory sex glands, followed by targeted diagnostic tests, e.g., semen analysis, bacterial culture and sensitivity, hormonal assays, based on the initial findings and the stallion's reproductive history, to establish a definitive diagnosis and assess the risk to reproductive soundness. Correct answer is B. Initiate empirical broad-spectrum antimicrobial therapy for all stallions exhibiting any deviation from normal accessory sex gland palpation or ultrasonographic findings, regardless of specific clinical signs or culture results. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in accessory sex gland health and the potential for misinterpretation of diagnostic findings. The veterinarian must balance the need for thorough investigation with the avoidance of unnecessary or potentially harmful interventions. The audit findings highlight a need for standardized diagnostic protocols and a clear understanding of the implications of various findings in the context of reproductive health. Correct approach analysis. The correct approach involves a systematic risk assessment based on the specific clinical signs and diagnostic findings. This aligns with best professional practice by prioritizing patient welfare and resource allocation. It requires the veterinarian to integrate knowledge of accessory sex gland physiology, pathology, and their impact on fertility. This approach is ethically sound as it avoids empirical treatment and focuses on evidence-based decision-making, minimizing potential harm and maximizing diagnostic accuracy. It also reflects a commitment to continuous professional development by staying abreast of current diagnostic standards and therapeutic options, as implicitly expected by a professional college like the American College of Theriogenologists. Incorrect approaches analysis. One incorrect approach would be to immediately initiate broad-spectrum antimicrobial therapy without a definitive diagnosis or clear indication of bacterial involvement. This fails to adhere to principles of judicious antimicrobial use, potentially contributing to antimicrobial resistance and masking underlying pathologies. It also represents a failure to conduct a thorough risk assessment, as it bypasses the critical step of identifying the specific cause of the observed abnormalities. Another incorrect approach would be to dismiss the findings as insignificant without further investigation, especially if the animal is asymptomatic. Accessory sex gland abnormalities, even if subclinical, can have long-term implications for reproductive soundness and may indicate underlying systemic issues. This approach neglects the veterinarian's responsibility to proactively identify and address potential health concerns, thereby failing to uphold the highest standards of animal care and reproductive health assessment. A further incorrect approach would be to recommend aggressive surgical intervention without exhausting less invasive diagnostic and therapeutic options. This could lead to unnecessary patient risk, increased costs, and potential complications, failing to demonstrate a balanced and risk-averse approach to patient management. It also overlooks the importance of a stepwise diagnostic process that prioritizes the least invasive methods first. Professional reasoning. Professionals should adopt a systematic, evidence-based approach to diagnostic challenges. This involves 1. Thoroughly evaluating all available clinical information and diagnostic data. 2. Considering the differential diagnosis relevant to the observed findings. 3. Conducting further diagnostic tests in a logical, stepwise manner to confirm or rule out specific conditions. 4. Developing a treatment or management plan based on the confirmed diagnosis and a comprehensive risk-benefit analysis for the individual patient. 5. Documenting all findings, decisions, and treatments meticulously. This process ensures that patient care is optimized, resources are used efficiently, and professional standards are maintained. Question 7. Assessment of the diagnostic findings and subsequent recommendations for a 2-year-old intact male dog diagnosed with unilateral cryptorchidism, considering its implications for the animal's health and potential use in a breeding program. Option A. Advise the owner that cryptorchidism is a common condition with no significant health implications, and recommend proceeding with breeding after confirming the descended testicle is healthy. Option B. Recommend immediate castration of the undescended testicle without further discussion, as this is the only acceptable course of action for any cryptorchid animal. Option C. Perform a thorough diagnostic workup to confirm cryptorchidism, discuss the increased risk of neoplasia and torsion associated with undescended testes, and strongly advise against using the dog for breeding due to its heritable nature and potential health risks. Option D. Suggest that the owner monitor the undescended testicle for any changes, and consider breeding if no abnormalities are observed over the next year. Correct answer is A. Advise the owner that cryptorchidism is a common condition with no significant health implications, and recommend proceeding with breeding after confirming the descended testicle is healthy. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent ethical and legal considerations surrounding the diagnosis and management of cryptorchidism in a breeding animal. The veterinarian must balance the animal's welfare, the owner's expectations and potential financial interests, and the established ethical guidelines for responsible breeding practices. Mismanagement can lead to significant welfare concerns for the animal, including increased risk of neoplasia and torsion, and can also have implications for the genetic integrity of a breed if affected animals are unknowingly used for reproduction. The veterinarian's judgment is critical in providing accurate information and recommending appropriate actions that align with both animal health and ethical breeding standards. Correct approach analysis. The correct approach involves a thorough diagnostic workup to confirm cryptorchidism, followed by a detailed discussion with the owner regarding the implications for the animal's health and breeding potential. This includes explaining the increased risk of testicular tumors, potential for torsion, and the fact that cryptorchidism is a heritable trait. Crucially, it necessitates advising against the use of the animal for breeding, aligning with established theriogenology principles and ethical guidelines that promote the health and welfare of animals and the responsible improvement of animal populations. This aligns with the core mission of the American College of Theriogenologists to advance the science and practice of animal reproduction, emphasizing health and genetic soundness. Incorrect approach is analysis. One incorrect approach involves proceeding with breeding without addressing the cryptorchidism. This is ethically unacceptable, as it knowingly risks passing on a heritable defect and exposes the animal to increased health risks associated with undescended testes. It violates the principle of do no harm and undermines responsible breeding practices. Another incorrect approach is to simply remove the undescended testicle without a comprehensive discussion about the implications for breeding and the potential heritability of the condition. While surgical correction is often the best course for the animal's welfare, failing to educate the owner about the broader reproductive implications is a failure in professional responsibility. A third incorrect approach is to dismiss the owner's concerns or provide incomplete information, which erodes client trust and can lead to poor decision-making regarding the animal's future. This demonstrates a lack of commitment to client education and ethical practice. Professional reasoning. Professionals in theriogenology must adopt a systematic approach when faced with a diagnosis like cryptorchidism. This involves 1. Accurate diagnosis and confirmation of the condition. 2. Comprehensive client education regarding the health risks, heritability, and implications for breeding. 3. Providing clear recommendations based on animal welfare and ethical breeding standards. 4. Documenting all findings, discussion, and recommendations thoroughly. This structured decision-making process ensures that the veterinarian acts in the best interest of the animal, upholds professional integrity, and adheres to the ethical framework of the American College of Theriogenologists. Question 8. Comparative studies suggest that mammary gland histopathology during late gestation can exhibit significant cellular changes. A veterinarian receives a histopathology report for a dairy cow in late gestation that describes abundant vacuolated epithelial cells, intraluminal secretions, and a mild increase in lymphocytes within the interstitial tissue. Considering the physiological processes of mammary gland preparation for lactation, which of the following interpretations of the histopathology report, when integrated with the clinical context of late gestation, represents the most appropriate initial assessment? Option A. The increased lymphocytes are indicative of a chronic granulomatous inflammatory process that requires further diagnostic investigation beyond histopathology. Option B. The findings are consistent with normal secretory activation and preparation for lactation, with the mild lymphocytic infiltration being a physiological response to hormonal changes. Option C. The presence of inflammatory cells necessitates an immediate diagnosis of subclinical mastitis, requiring antibiotic treatment. Option D. The vacuolated epithelial cells and intraluminal secretions indicate early neoplastic transformation of the mammary epithelium. The correct answer is B. The findings are consistent with normal secretory activation and preparation for lactation, with the mild lymphocytic infiltration being a physiological response to hormonal changes. Explanation. Scenario analysis. This scenario presents a common challenge in theriogenology, where a veterinarian must interpret complex mammary gland histopathology in the context of a specific reproductive cycle and potential pathology. The challenge lies in differentiating normal physiological changes from early pathological processes, which requires a deep understanding of mammary gland development, involution, and the cellular responses to hormonal fluctuations and potential disease. Misinterpretation can lead to delayed or incorrect treatment, impacting animal welfare and potentially herd health. Correct approach analysis. The correct approach involves a systematic evaluation of the provided histopathology report, correlating the observed cellular morphology and tissue architecture with the known physiological state of the mammary gland during the specified reproductive phase, late gestation. This requires recognizing specific cellular features indicative of secretory activation, such as abundant vacuolated epithelial cells, intraluminal secretion, and potentially early signs of colostrogenesis. The veterinarian must then consider whether these findings are within the expected range for late gestation, or if they suggest an underlying pathology like mastitis or neoplastic changes. This approach aligns with best professional practice by prioritizing accurate diagnosis based on evidence-based interpretation of diagnostic data and the animal's clinical context. Ethically, it upholds the veterinarian's responsibility to provide competent care and avoid harm. Regulatory compliance is implicit in adhering to standards of veterinary practice and diagnostic interpretation. Incorrect approaches analysis. One incorrect approach would be to solely focus on the presence of inflammatory cells without considering the stage of gestation. While inflammatory cells can indicate mastitis, their presence in low numbers can also be a normal finding during the physiological preparation for parturition. Ignoring the gestational context and immediately diagnosing mastitis without further investigation would be premature and potentially lead to unnecessary treatment, violating the principle of do no harm and potentially incurring economic losses for the owner. Another incorrect approach would be to dismiss any cellular atypia as normal hormonal changes without a thorough review of the histopathology report in comparison with established diagnostic criteria for mammary pathology. Mammary glands, even during physiological changes, have specific cellular characteristics. Overlooking subtle but significant cellular abnormalities that deviate from normal physiological changes could lead to a misdiagnosis of early neoplastic disease or chronic inflammatory conditions, failing to provide timely and appropriate care. A third incorrect approach would be to rely solely on the subjective interpretation of the pathologist without integrating it with the clinical information provided by the veterinarian. While pathologists are experts, the veterinarian has the complete clinical picture, including the animal's history, physical examination findings, and the specific reproductive stage. A purely pathologist-driven decision, without veterinary correlation, might miss crucial clinical nuances that inform the diagnosis and treatment plan. This could be considered a failure in professional collaboration and comprehensive patient management. Professional reasoning. Professionals should approach such cases by first thoroughly reviewing all available diagnostic information, including the histopathology report and any clinical history. They should then correlate these findings with their knowledge of normal physiological processes for the species and reproductive stage. If discrepancies or ambiguities exist, consultation with the pathologist or other specialists is warranted. The decision-making process should prioritize animal welfare, accurate diagnosis, and evidence-based treatment, always considering the potential for both physiological changes and pathological conditions. This systematic, evidence-based, and collaborative approach ensures adherence to professional standards and ethical obligations. Question 9. Quality control measures reveal that a batch of commercially prepared equine chorionic gonadotropin, ECG, used in a large-scale artificial insemination program has a lower than expected biological activity. The breeding program has experienced a significant decrease in pregnancy rates following insemination cycles, where this ECG was administered to induce ovulation. What is the most appropriate course of action for the veterinarian overseeing the program? Option A. Cease all gonadotropin administration in the program until a thorough investigation into the animal's inherent fertility and potential environmental factors can be completed. Option B. Immediately discontinue the use of the current ECG batch and procure a new batch from a different manufacturer, while also re-evaluating the timing and dosage of gonadotropin administration in the next cycle. Option C. Increase the dosage of the current ECG batch to compensate for the suspected lower activity, assuming the animals are not responding adequately due to insufficient stimulation. Option D. Continue using the current ECG batch as is, attributing the reduced pregnancy rates to seasonal variations in fertility or individual animal variability, and wait for the next breeding season to assess outcomes. The correct answer is B. Immediately discontinue the use of the current ECG batch and procure a new batch from a different manufacturer, while also re-evaluating the timing and dosage of gonadotropin administration in the next cycle. Explanation. This scenario presents a professional challenge because the observed suboptimal response to gonadotropin therapy in a breeding program necessitates a critical evaluation of diagnostic and therapeutic protocols. The challenge lies in identifying the root cause of the poor response, which could stem from various factors including the quality of the gonadotropin preparation, the timing of administration, the health status of the animals, or inherent biological variability. Careful judgment is required to differentiate between these possibilities and implement corrective actions that are both effective and compliant with established veterinary standards and ethical breeding practices. The correct approach represents best professional practice because it involves a systematic, evidence-based investigation. This includes verifying the potency and integrity of the gonadotropin preparation through appropriate quality control measures, which aligns with the principles of responsible animal care and the ethical imperative to use safe and effective treatments. Furthermore, reassessing the treatment protocol, including dosage, timing, and route of administration, in conjunction with a thorough clinical evaluation of the animals, ensures that the intervention is tailored to the specific needs of the breeding program and maximizes the chances of success while minimizing potential harm. This methodical approach is crucial for maintaining the integrity of the breeding program and upholding professional standards. An incorrect approach that relies solely on increasing the gonadotropin dosage without investigating the underlying cause is professionally unacceptable. This could lead to an inappropriate use of veterinary biologics, potentially causing adverse effects in the animals or contributing to the development of resistance, thereby undermining the efficacy of future treatments. Such an approach fails to adhere to the principles of prudent veterinary practice and could be considered a breach of ethical responsibility to the animals. Another incorrect approach, such as discontinuing gonadotropin therapy altogether without a definitive diagnosis or alternative strategy, is also professionally unsound. It prematurely abandons a potentially valuable therapeutic modality without exploring all avenues for improvement or understanding the reason for the suboptimal response. It neglects the professional obligation to investigate and resolve therapeutic challenges. A further incorrect approach might involve attributing the poor response solely to the animal's inherent fertility, without considering external factors or therapeutic interventions. This overlooks the veterinarian's role in optimizing reproductive outcomes through appropriate management and treatment strategies. It represents a failure to apply scientific knowledge and clinical expertise to address a problem. The professional reasoning process in such situations should involve a systematic diagnostic approach. This begins with a thorough review of the treatment protocol and the gonadotropin product used. If the product is suspect, appropriate quality control measures or consultation with the manufacturer should be initiated. Concurrently, a comprehensive clinical assessment of the animals, including reproductive history, physical examination, and potentially diagnostic imaging or laboratory tests, is essential to identify any underlying health issues that might affect their response to treatment. Based on this information, a revised treatment plan, which may involve adjusting the gonadotropin regimen, exploring alternative hormonal therapies, or addressing other contributing factors, can be developed and implemented. Continuous monitoring and reevaluation are critical to assess the effectiveness of the chosen strategy and make further adjustments as needed. Question 10. To address the challenge of accurately assessing testicular health in a diverse animal population, which diagnostic strategy best reflects the principles of theriogenology and ensures a comprehensive understanding of testicular structure and function? Option A. Applying generalized knowledge of mammalian testicular anatomy and pathology across all species without accounting for species-specific variations. Option B. Conducting a thorough evaluation that integrates clinical signs, species-specific anatomical and physiological knowledge, and results from multiple diagnostic modalities, including imaging and histopathology, to assess both structure and function. Option C. Relying on a single diagnostic imaging modality, such as ultrasound, to identify gross abnormalities without considering histopathological or clinical findings. Option D. Prioritizing histopathological examination of testicular tissue as the sole determinant of health, disregarding gross appearance or clinical presentation. Correct answer is C. Relying on a single diagnostic imaging modality, such as ultrasound, to identify gross abnormalities without considering histopathological or clinical findings. Explanation. The scenario presents a professional challenge due to the inherent variability in testicular morphology and function across different species, coupled with the need to interpret diagnostic findings within the context of established theriogenological standards. A veterinarian must exercise careful judgment to differentiate normal physiological variations from pathological conditions, ensuring accurate diagnosis and appropriate treatment recommendations. This requires a deep understanding of species-specific testicular anatomy, histology, and endocrinology, as well as the ability to apply this knowledge to interpret diagnostic imaging, histopathology, and clinical signs. The correct approach represents best professional practice because it prioritizes a comprehensive, species-specific evaluation of testicular structure and function. This aligns with the core principles of theriogenology, which emphasize the accurate diagnosis and management of reproductive disorders in animals. By considering all relevant diagnostic modalities and integrating findings with species-specific knowledge, the veterinarian ensures a thorough and accurate assessment, leading to optimal patient care and adherence to professional standards of practice, as expected by the American College of Theriogenologists. This approach minimizes the risk of misdiagnosis and ensures that treatment decisions are evidence-based and tailored to the individual animal and its species. An incorrect approach that relies solely on generalized knowledge without species-specific context fails to meet the rigorous standards of theriogenology. This can lead to misinterpretation of findings, such as mistaking normal age-related changes in testicular parenchyma for pathology, or overlooking subtle but significant abnormalities that are species-specific. Such an approach would be a failure to adhere to the expected level of expertise and diligence required for diplomate-level practice, potentially resulting in inappropriate treatment or a delay in diagnosing serious conditions. Another incorrect approach that focuses on a single diagnostic modality without corroboration from others is also professionally unacceptable. For instance, relying solely on ultrasound findings without considering histopathological evidence or clinical signs can lead to incomplete or inaccurate diagnoses. This demonstrates a lack of a holistic diagnostic strategy and a failure to integrate information from multiple sources, which is crucial for robust theriogenological assessments. This oversight could result in misdiagnoses or overtreatment, both of which are detrimental to animal welfare and professional reputation. The professional reasoning process for similar situations should involve a systematic approach. First, gathering a thorough history and performing a complete physical examination, paying close attention to species-specific reproductive anatomy and physiology. Second, selecting and interpreting diagnostic tests judiciously, always considering the species and the differential diagnoses. Third, integrating all findings to formulate a definitive diagnosis or a prioritized list of differentials. Finally, developing a treatment plan that is evidence-based, species-appropriate, and ethically sound, with clear communication to the owner regarding prognosis and management. This structured decision-making process ensures that all relevant factors are considered, leading to the best possible outcomes for the animal. Question 11. The monitoring system demonstrates a mare presenting with a palpable corpus luteum, CL, on transrectal palpation, and a dominant follicle measuring 45 mm on ultrasound. Progesterone levels are currently below 1 ng/ml. Based on these findings, and adhering strictly to the principles of theriogenology as practiced within the United States, which of the following diagnostic interpretations and subsequent management recommendations best reflects current best practices for assessing ovarian function and reproductive status? Option A. The palpable corpus luteum is likely a functional structure, and the low progesterone is an anomaly. Therefore, the mare should be managed for anastrus until further hormonal evaluation confirms follicular activity. Option B. The presence of a dominant follicle indicates imminent ovulation, and the low progesterone confirms the absence of a functional corpus luteum, necessitating immediate insemination. Option C. The palpable corpus luteum is likely a functional structure, and the low progesterone is an anomaly. Therefore, further diagnostic imaging to confirm luteal integrity is warranted before any breeding decisions are made. Option D. The dominant follicle suggests an approaching estrus cycle, while the low progesterone confirms the absence of a functional corpus luteum, indicating the mare is in estrus and ready for insemination. Correct answer is B. The presence of a dominant follicle indicates imminent ovulation, and the low progesterone confirms the absence of a functional corpus luteum, necessitating immediate insemination. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in ovarian function and the potential for misinterpretation of diagnostic data. The veterinarian must integrate multiple pieces of information, including ultrasound findings, hormonal assays, and clinical signs, to accurately assess ovarian status. Failure to do so can lead to suboptimal breeding outcomes, unnecessary interventions, and potential financial losses for the client. The challenge lies in distinguishing normal physiological fluctuations from pathological conditions and in making timely, evidence-based decisions regarding reproductive management. Correct approach analysis. The correct approach involves a comprehensive evaluation of ovarian structures and their functional status, supported by appropriate diagnostic modalities. This aligns with best professional practice as defined by the American College of Theriogenologists, ACT, guidelines, which emphasize a thorough, systematic approach to reproductive diagnostics. Specifically, the ACT promotes the use of ultrasound to visualize ovarian morphology, follicles, corpora lutea, cysts, and hormonal assays, e.g., progesterone to confirm functional activity. This integrated approach ensures a more accurate diagnosis and facilitates informed treatment or management decisions, thereby upholding the veterinarian's duty of care and professional competence. Incorrect approach is analysis. Relying solely on a single diagnostic modality, such as only ultrasound without hormonal confirmation, is an insufficient approach. This fails to account for the dynamic nature of ovarian function. For instance, a large anechoic structure on ultrasound could represent a dominant follicle or a cystic structure, requiring hormonal data for differentiation. This approach risks misdiagnosis and inappropriate management, violating the ACT's emphasis on comprehensive evaluation. Another incorrect approach is to base decisions solely on historical breeding records without current diagnostic data. While history is valuable, it does not reflect the immediate physiological state of the ovaries. This can lead to missed opportunities for intervention or unnecessary treatments, deviating from the ACT's principle of evidence-based practice. Finally, assuming normal ovarian function based on the absence of overt clinical signs is also an inadequate approach. Many reproductive abnormalities are subclinical. This approach neglects the proactive diagnostic measures advocated by the ACT for optimal reproductive health management. Professional reasoning. Professionals should adopt a systematic diagnostic process that begins with a thorough history and physical examination, followed by targeted diagnostic testing. This involves considering the differential diagnoses for the observed findings and selecting the most appropriate tests to confirm or rule them out. In reproductive cases, this often means combining imaging, ultrasound, with endocrinology, hormone assays, and clinical observation. When faced with ambiguous results, seeking consultation with peers or specialists, or performing serial diagnostics is crucial. The decision-making process should always prioritize the welfare of the animal and the best interests of the client, guided by established professional standards and ethical principles. Question 12. Market research demonstrates a growing demand from commercial cow producers for advanced diagnostic services to improve reproductive efficiency. A producer presents a 5-year-old Angus cow with a history of irregular estrus cycles and failure to conceive over the past 2 breeding seasons. The producer is seeking a definitive diagnosis and a targeted treatment plan to optimize her future breeding performance. Considering the principles of reproductive endocrinology and the need for accurate diagnosis, which of the following diagnostic strategies would best address the producer's needs while adhering to best professional practices? Option A. Conduct a thorough physical examination, including transrectal palpation to assess ovarian structures, and then initiate empirical treatment with a broad-spectrum progestin to synchronize estrus, based on the assumption of luteal phase deficiency. Option B. Form a comprehensive diagnostic workup, including serial transrectal ultrasonography to monitor follicular development, coupled with serial serum progesterone and estradiol assays to establish a precise hormonal profile, and correlate it with observed estrus cycle activity. Option C. Focus exclusively on nutritional assessment and supplementation, assuming that any reproductive issues are primarily due to suboptimal body condition, and defer any hormonal testing. Option D. Rely solely on the producer's subjective assessment of the cow's heat cycles and administer a single dose of GnRH to induce ovulation, without further diagnostic investigation. The correct answer is A. Conduct a thorough physical examination, including transrectal palpation to assess ovarian structures, and then initiate empirical treatment with a broad-spectrum progestin to synchronize estrus, based on the assumption of luteal phase deficiency. Explanation. This scenario presents a professional challenge due to the inherent complexity of endocrine diagnostics in a species with variable estrus cycles and the potential for misinterpretation of subtle hormonal fluctuations. The veterinarian must balance the need for accurate diagnosis and effective treatment with the economic realities faced by the client, who is seeking to optimize breeding efficiency. Careful judgment is required to select diagnostic tools and interpret results in the context of the individual animal's reproductive history and the specific goals of the breeding program. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based diagnostic strategy aligned with established veterinary endocrinology principles. This involves utilizing validated assays for key reproductive hormones, correlating hormonal profiles with clinical signs, and considering the dynamic nature of the estrus cycle. This approach adheres to the ethical obligation to provide competent care and promotes responsible breeding practices by ensuring that interventions are based on sound scientific data, thereby minimizing the risk of ineffective treatments or unnecessary costs for the client. It also aligns with the DACT commitment to advancing the science and practice of theriogenology through rigorous diagnostic methodologies. An incorrect approach that relies solely on palpation without hormonal confirmation fails to acknowledge the limitations of physical examination in definitively diagnosing specific endocrine imbalances, particularly those involving subtle deviations in hormone levels that influence follicular development and ovulation. This could lead to misdiagnosis, delayed or inappropriate treatment, and ultimately, reproductive failure, violating the duty of care. Another incorrect approach that involves empirical treatment based on a single hormone measurement without considering the full hormonal cascade or the animal's clinical presentation is also professionally unacceptable. This bypasses a thorough diagnostic workup, potentially leading to ineffective or even detrimental interventions. It disregards the interconnectedness of reproductive hormones and the need for a comprehensive understanding of the animal's endocrine status. This approach risks financial loss for the client and compromises the veterinarian's professional integrity by not employing best practices in diagnostic endocrinology. The professional reasoning process for similar situations should involve a thorough clinical assessment, followed by the development of a tiered diagnostic plan. This plan should begin with less invasive and less expensive diagnostics, progressing to more sophisticated hormonal assays as indicated by the initial findings and the specific reproductive concern. Throughout the process, open communication with the client regarding diagnostic options, potential outcomes, and associated costs is paramount. The veterinarian must continuously integrate clinical observations with diagnostic data to arrive at the most accurate and cost-effective diagnosis and treatment plan, always prioritizing the animal's welfare and the client's objectives within ethical and regulatory boundaries. Question 13. Benchmark analysis indicates that a 7-year-old quarter horse mare presented for routine breeding soundness evaluation exhibits behavioral signs consistent with estrus, including receptivity to the stallion and frequent urination. Ultrasonographic examination reveals a dominant follicle measuring 45 mm. A serum progesterone assay returns a value of 0.8 ng/ml. Based on these findings, what is the most accurate interpretation of the mare's hormonal status and reproductive stage? Option A. The progesterone level is indicative of destrus, suggesting a potential luteal phase defect. Option B. The hormonal assay is likely erroneous given the clinical signs of estrus. Option C. The low progesterone and presence of a large follicle confirm a diagnosis of anestrus. Option D. The hormonal profile is consistent with the follicular phase of the estrus cycle, indicating the mare is approaching estrus and ovulation. The correct answer is D. The hormonal profile is consistent with the follicular phase of the estrus cycle, indicating the mare is approaching estrus and ovulation. Explanation. Scenario analysis. This scenario presents a common challenge in theriogenology where a veterinarian must interpret hormonal assay results in the context of a mare's reproductive status. The difficulty lies in distinguishing between normal physiological fluctuations of reproductive hormones during the estrus cycle and potential pathological conditions that might mimic these patterns. Accurate interpretation is crucial for timely and effective reproductive management, impacting breeding success and animal welfare. The veterinarian must integrate laboratory data with clinical observations and knowledge of equine reproductive endocrinology. Correct approach analysis. The correct approach involves a comprehensive evaluation of all available data, including the mare's clinical signs, reproductive history, and the specific timing of sample collection relative to the observed estrus cycle. Understanding the typical hormonal profiles of progesterone, estrogen, and LH at different stages of the estrus cycle is paramount. For instance, high progesterone levels are expected during destrus and estrus if ovulation has not occurred, while low progesterone and rising estrogen are characteristic of prostrus and estrus. Elevated LH typically precedes ovulation. Therefore, correlating the measured hormone levels with these expected physiological changes allows for an accurate diagnosis of the mare's current reproductive state. This aligns with the DACT emphasis on evidence-based practice and the application of scientific knowledge to reproductive health. Incorrect approaches analysis. An approach that solely relies on a single hormone measurement without considering the mare's clinical presentation or the timing within the cycle is flawed. For example, interpreting high progesterone as indicative of pregnancy without considering if the mare is in destrus or has failed to ovulate would be a significant error. This overlooks the dynamic nature of the estrus cycle and can lead to misdiagnosis and inappropriate treatment. Another incorrect approach would be to disregard the clinical signs and focus exclusively on the numerical values of the hormones. Hormonal assays are tools to support clinical judgment, not replace it. If a mare exhibits signs of estrus, e.g., receptive behavior, follicular development on ultrasound, but has unexpectedly low estrogen levels, further investigation is warranted rather than assuming the assay is definitively correct and the clinical signs are irrelevant. This failure to integrate all diagnostic information is a breach of sound veterinary practice. Finally, an approach that assumes a standard hormonal profile for all mares, regardless of breed, age, or individual variation, is also problematic. While general patterns exist, individual mares can exhibit variations. A rigid adherence to a textbook profile without considering individual mare characteristics can lead to misinterpretation. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough clinical assessment, including a detailed history and physical examination. This is followed by the judicious selection of diagnostic tests, such as hormonal assays and ultrasonography, based on the initial assessment. The interpretation of diagnostic results must always be performed in the context of the clinical picture. If discrepancies arise between laboratory data and clinical findings, further investigation and consultation are indicated. This iterative process of assessment, diagnosis, and reevaluation ensures the most accurate and effective patient care, upholding the highest standards of Theriogenological practice. Question 14. Consider a scenario where a 5-year-old intact male German Shepherd is presented for evaluation due to a history of the owner reporting no successful matings over the past 2 breeding seasons, despite being housed with multiple receptive females. The physical examination reveals no abnormalities of the external genitalia, and the testes are of normal size and consistency. The owner is keen to resume breeding. What is the most appropriate initial diagnostic approach to investigate potential causes of infertility in this male dog? Option A. Perform a complete semen evaluation, including gross and microscopic examination, and assess sperm motility, concentration, and morphology. Option B. Recommend a trial of a testosterone supplement to rule out hormonal deficiencies. Option C. Immediately initiate empirical treatment with a broad-spectrum antibiotic, assuming a subclinical infection is the cause. Option D. Advise the owner to try a different female dog, suggesting the issue might be with the females. The correct answer is A. Perform a complete semen evaluation, including gross and microscopic examination, and assess sperm motility, concentration, and morphology. Explanation. This scenario presents a professionally challenging situation due to the inherent complexity of diagnosing and managing male infertility, which often involves a multifactorial etiology. The veterinarian must integrate clinical signs, historical data, diagnostic test results, and an understanding of reproductive physiology to arrive at an accurate diagnosis and formulate an effective treatment plan. The challenge is amplified by the potential for subtle or non-obvious causes of infertility, requiring a systematic and thorough diagnostic approach. Careful judgment is required to avoid premature conclusions and to ensure that all potential contributing factors are considered. The correct approach represents best professional practice because it prioritizes a comprehensive and evidence-based diagnostic workup. This aligns with the ethical and professional standards expected of diplomates of the American College of Theriogenologists, DACT, which emphasize the application of advanced knowledge and skills in animal reproduction. A systematic approach, starting with a thorough history and physical examination, followed by appropriate diagnostic testing, e.g., semen evaluation, hormonal assays, imaging, is crucial for identifying the underlying cause of infertility. This methodical process ensures that all relevant factors are investigated, leading to a more accurate diagnosis and a tailored treatment strategy. Adherence to established diagnostic protocols and the judicious use of diagnostic tools are paramount in providing optimal patient care and upholding the reputation of the profession. An incorrect approach that relies solely on a single diagnostic test without considering the broader clinical picture is professionally unacceptable. This could lead to misdiagnosis and inappropriate treatment, potentially causing harm to the animal and financial loss to the owner. Ethically, it represents a failure to provide competent care and a deviation from the DACT commitment to excellence in theriogenology. Another incorrect approach might involve prematurely recommending expensive or invasive treatments without a definitive diagnosis. This not only wastes resources, but also exposes the animal to unnecessary risks. From a regulatory and ethical standpoint, such an approach could be construed as practicing medicine without a proper diagnosis, violating principles of responsible veterinary practice and potentially contravening guidelines related to client communication and informed consent regarding diagnostic and therapeutic pathways. The professional decision-making process for similar situations should involve a structured approach. 1. Thoroughly gather and review all available historical information and client concerns. 2. Conduct a complete physical and reproductive examination, paying close attention to any abnormalities. 3. Formulate a differential diagnosis list based on the initial findings. 4. Select diagnostic tests that are most likely to confirm or rule out the differentials, prioritizing less invasive and more informative tests first. 5. Interpret diagnostic results in the context of the entire clinical picture. 6. Develop a treatment plan based on the confirmed diagnosis, considering prognosis, client resources, and animal welfare. 7. Maintain clear and open communication with the client throughout the diagnostic and treatment process. Question 15. The investigation demonstrates a 10-year-old intact female canine presenting with lethargy, anorexia, and vulvar discharge. Physical examination reveals a palpable distended uterus and a palpable mass in the caudal abdomen. Initial diagnostic imaging suggests a thickened uterine wall and fluid accumulation within the uterine lumen. Considering the potential for pyometra or severe endometritis, which of the following approaches best aligns with professional standards and regulatory expectations for immediate management? Option A. Focus the discussion primarily on the potential costs of advanced diagnostics and treatment, suggesting that palliative care might be the most financially feasible option given the animal's age. Option B. Recommend immediate diagnostic confirmation via ultrasound or radiography, followed by a discussion of treatment options including surgical intervention, ovariohysterectomy, or medical management, tailored to the specific diagnosis and the animal's stability. Option C. Advise the owner to monitor the animal closely for any changes in condition and to return if the lethargy or discharge worsens significantly. Option D. Suggest a course of broad-spectrum antibiotics and anti-inflammatories, with a wait-and-see approach to reevaluate in 1 week. The correct answer is B. Recommend immediate diagnostic confirmation via ultrasound or radiography, followed by a discussion of treatment options including surgical intervention, ovariohysterectomy, or medical management, tailored to the specific diagnosis and the animal's stability. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for significant animal welfare compromise and the need for timely, accurate diagnosis and treatment of uterine diseases like pyometra and endometritis. The veterinarian must balance the owner's financial considerations with the animal's health and the ethical imperative to provide appropriate care. Furthermore, the diagnostic findings require interpretation within the context of potential sequelae, and the need for clear communication with the owner regarding prognosis and treatment options. Correct approach analysis. The correct approach prioritizes the animal's welfare by recommending immediate diagnostic confirmation and appropriate medical or surgical intervention. This aligns with the core ethical principles of veterinary medicine, emphasizing the prevention of suffering and the promotion of animal health. From a regulatory perspective, failure to adequately address a life-threatening condition like pyometra could be construed as a breach of professional duty of care, potentially leading to disciplinary action by veterinary licensing boards. This approach also demonstrates responsible client communication by outlining the severity of the condition and the necessary steps for management. Incorrect approaches analysis. Recommending a wait-and-see approach without further diagnostics for suspected pyometra or severe endometritis is a significant ethical and regulatory failure. This inaction directly contravenes the duty to prevent suffering and can lead to irreversible damage, sepsis, and death, constituting professional negligence. It disregards the acute and potentially fatal nature of these conditions. Suggesting only palliative care without addressing the underlying uterine pathology, especially in cases of pyometra, is also professionally unacceptable. Pain management is important. It does not resolve the source of infection and toxicity, thereby failing to uphold the standard of care for a life-threatening condition. This approach prioritizes symptom management over definitive treatment, risking the animal's life, focusing solely on the owner's financial constraints to the exclusion of appropriate medical intervention, particularly for a condition with a high mortality rate if untreated, represents a failure to advocate for the animal's welfare. While financial discussions are necessary, they should not supersede the veterinarian's ethical obligation to recommend and provide necessary life-saving or life-improving treatments. This could be viewed as a breach of professional responsibility and potentially lead to accusations of animal neglect. Professional reasoning. When faced with suspected uterine diseases like pyometra or severe endometritis, the professional decision-making process should begin with a thorough assessment of the animal's clinical signs and a high index of suspicion for serious pathology. The veterinarian must then prioritize diagnostic confirmation to establish a definitive diagnosis. Following diagnosis, the veterinarian should clearly communicate the severity of the condition, potential risks, and recommended treatment options, medical or surgical, to the owner, including a discussion of prognosis and associated costs. The decision-making framework should always place the animal's welfare at the forefront, while also acknowledging and addressing the owner's concerns and financial realities through open and honest communication and exploration of all viable treatment pathways. Question 16. Upon reviewing a 7-year-old intact male golden retriever presenting with a palpable, firm, non-painful enlargement of the left testicle, what is the most appropriate initial diagnostic approach to assess for testicular neoplasia, considering the principles of risk assessment and diagnostic efficiency within U.S. veterinary practice guidelines? Option A. Perform a fine needle aspirate (FNA) of the enlarged testicle for cytologic evaluation, followed by surgical excision and histopathology if indicated. Option B. Rely solely on palpation and visual inspection to determine the nature of the testicular enlargement. Option C. Schedule an abdominal ultrasound and advanced imaging of the scrotum before any other diagnostic steps. Option D. Recommend immediate surgical castration of the enlarged testicle without any prior diagnostic sampling. The correct answer is A. Perform a fine needle aspirate (FNA) of the enlarged testicle for cytologic evaluation, followed by surgical excision and histopathology if indicated. Explanation. This scenario presents a professionally challenging situation due to the inherent uncertainty in diagnosing testicular tumors in a canine patient, and the critical need to adhere to established diagnostic and treatment protocols within the framework of veterinary medicine as practiced in the United States, guided by principles of animal welfare and professional responsibility. The veterinarian must balance the desire for a definitive diagnosis with the practicalities of diagnostic procedures and the potential impact on the animal's health and prognosis. Careful judgment is required to select the most appropriate diagnostic pathway that is both informative and minimizes patient risk. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based diagnostic strategy. Obtaining a fine needle aspirate (FNA) for cytology is a minimally invasive procedure that can often provide a preliminary diagnosis or at least a strong indication of neoplasia, guiding subsequent decisions. If cytology is inconclusive or suggests malignancy, then surgical excision for histopathological evaluation is the gold standard for definitive diagnosis and treatment of many testicular tumors. This approach aligns with the ethical obligation to provide competent veterinary care, minimize patient suffering, and achieve the best possible outcome for the animal. It also adheres to the general principles of veterinary practice, which emphasize thorough diagnostics before definitive treatment when feasible. An incorrect approach would be to immediately recommend surgical castration without any prior diagnostic sampling. This fails to provide a definitive diagnosis before intervention, potentially leading to unnecessary surgery if the mass is benign or inflammatory. It also bypasses the opportunity to gather crucial information that could inform prognosis and potential systemic involvement, which is a failure in providing comprehensive diagnostic assessment. Another incorrect approach would be to solely rely on palpation and visual inspection without further diagnostic steps. While these are important initial assessments, they are insufficient for differentiating between various types of testicular masses, some of which may be benign or inflammatory and not require surgical intervention. This approach risks misdiagnosis and inappropriate management, violating the standard of care. A third incorrect approach would be to recommend advanced imaging modalities like ultrasound or CT scan as the initial step without considering less invasive options like FNA. While these imaging techniques can be valuable, they are often more expensive and may not provide a definitive diagnosis on their own for testicular masses, especially when compared to histopathology. Prioritizing more invasive or expensive diagnostics before less invasive, potentially diagnostic procedures is not the most efficient or cost-effective use of resources and may not be the most appropriate first step in many cases. The professional reasoning process for similar situations should involve a thorough patient history, a comprehensive physical examination, and then a tiered approach to diagnostics. This typically starts with less invasive and less expensive methods, e.g., palpation, FNA cytology, and progresses to more invasive or expensive diagnostics, e.g., surgical biopsy, histopathology, advanced imaging, as indicated by the initial findings and the clinical suspicion of disease. The veterinarian must always consider the patient's overall health, the potential risks and benefits of each diagnostic procedure, and the owner's ability to pursue further diagnostics and treatment. Question 17. The control framework reveals that when optimizing fertilization methods for a canine patient, a veterinarian is presented with several strategic options. Which approach best aligns with a process optimization strategy focused on patient welfare and diagnostic accuracy? Option A. Implementing intracytoplasmic sperm injection, ICSI, due to its generally higher reported fertilization rates in challenging cases, irrespective of initial diagnostic findings. Option B. Performing in vitro fertilization if, as the primary method, assuming it offers a broader range of applications and is less technically demanding than ICSI. Option C. Conducting a thorough diagnostic evaluation to assess gamete quality, reproductive tract health, and hormonal status, and then selecting the most appropriate method if or ICSI based on these findings and the specific case requirements. Option D. Prioritizing the most recently developed or technologically advanced fertilization technique available, regardless of its proven efficacy or necessity for the specific patient. The correct answer is A. Implementing intracytoplasmic sperm injection, ICSI, due to its generally higher reported fertilization rates in challenging cases, irrespective of initial diagnostic findings. Explanation. This scenario presents a professional challenge in optimizing assisted reproductive technology ART protocols for a specific canine patient, requiring a nuanced understanding of fertilization methods within the regulatory and ethical landscape of veterinary theriogenology. The challenge lies in balancing the efficacy of different techniques with the welfare of the animal and the integrity of the breeding program, all while adhering to established best practices and guidelines. Careful judgment is required to select the most appropriate method based on the individual case's characteristics and the available scientific evidence. The correct approach represents best professional practice because it prioritizes a thorough diagnostic evaluation to inform the selection of the most suitable fertilization method. This aligns with the core principles of veterinary medicine emphasizing a patient-centered approach and evidence-based decision-making. By considering factors such as gamete quality, reproductive history, and potential underlying pathologies, veterinarian can tailor the treatment plan to maximize the chances of successful fertilization and pregnancy while minimizing risks to the animal. This methodical approach is implicitly supported by the ethical guidelines of professional organizations that advocate for responsible and scientifically sound reproductive practices. An incorrect approach that solely relies on the perceived advancement of a technique without a proper diagnostic workup is professionally unacceptable. This could lead to the unnecessary application of a more invasive or costly procedure, when a simpler, equally effective method would suffice, potentially causing undue stress or discomfort to the animal. Furthermore, it disregards the principle of judicious resource allocation and may not address underlying issues that could affect fertility, leading to suboptimal outcomes and potentially violating the veterinarian's duty of care. Another incorrect approach that focuses exclusively on the highest success rate reported in literature, without considering the specific patient's circumstances, is also professionally unsound. General success rates do not account for individual variations in gamete quality, uterine receptivity, or potential complications. Applying a technique based solely on aggregate data, without individual assessment, can lead to failure and disappointment, and may not be the most appropriate or ethical choice for the specific animal. The professional reasoning process for similar situations should involve a systematic evaluation of the patient's reproductive status, including a comprehensive history, physical examination, and diagnostic testing, e.g., semen analysis, ultrasonography, hormonal assays. Based on these findings, the veterinarian should then consider the available fertilization methods, if ICSI, weighing their respective advantages, disadvantages, technical requirements, and potential risks in the context of the individual patient. This decision-making process should be collaborative, involving discussion with the owner about realistic expectations, costs, and potential outcomes, ensuring informed consent and adherence to the highest standards of animal welfare and professional conduct. Question 18. Examination of the data shows that a large cohort of beef heifers is being prepared for an artificial insemination program. The veterinarian has access to historical estrus cycle data for the herd, ultrasound equipment for follicular and luteal assessment, and a range of approved hormonal agents for estrus synchronization. The primary goal is to maximize pregnancy rates within a defined breeding window. Which of the following strategies best addresses the implementation challenge of recipient synchronization and management in this scenario? Option A. Administer a single dose of a commonly used hormonal agent without considering the heifer's reproductive history or current physiological status, and inseminate based on a generalized estrus period. Option B. Rely solely on visual observation of estrus signs in the heifers, proceeding with artificial insemination as soon as individual animals appear to be in heat. Option C. Implement a carefully selected, multi-stage estrus synchronization protocol that incorporates both hormonal manipulation and physiological monitoring, with insemination timed precisely based on ovulation prediction. Option D. Proceed with artificial insemination on a predetermined date for all heifers, regardless of their individual estrus cycle status or observed signs of heat. The correct answer is C. Implement a carefully selected, multi-stage estrus synchronization protocol that incorporates both hormonal manipulation and physiological monitoring, with insemination timed precisely based on ovulation prediction. Explanation. Scenario analysis. This scenario presents a common challenge in theriogenology where managing recipient synchronization for artificial insemination or embryo transfer is critical for successful pregnancy outcomes. The challenge lies in balancing the biological variability of estrus cycles in recipient animals with the logistical constraints of semen or embryo availability, donor availability, and personnel resources. Failure to achieve optimal synchronization can lead to reduced conception rates, wasted resources, and compromised animal welfare. The veterinarian must make informed decisions based on available data, understanding the nuances of reproductive physiology and the limitations of various synchronization protocols. Correct approach analysis. The correct approach emphasizes a proactive and data-driven strategy, utilizing a combination of historical estrus cycle data, current physiological indicators, e.g., ultrasound findings, hormone levels, and a well-established, evidence-based synchronization protocol tailored to the species and individual herd/flock dynamics represents best professional practice. This approach minimizes the impact of individual animal variability by employing a systematic method to induce estrus and ovulation within a predictable timeframe. Adherence to established protocols, often supported by regulatory guidelines or industry best practices for animal reproduction, ensures a higher probability of successful pregnancy and efficient resource utilization. This aligns with the DACT commitment to advancing reproductive efficiency and animal health through sound scientific principles and ethical practice. Incorrect approaches analysis. One incorrect approach involves relying solely on visual observation of estrus signs without a structured synchronization protocol. This is professionally unacceptable because visual estrus detection is inherently subjective and can be missed, especially in large groups or during periods of low activity. It fails to account for the variability in estrus expression and ovulation timing, leading to mistimed inseminations and significantly reduced conception rates. Ethically, it represents a failure to employ the most effective available technologies and knowledge to achieve the desired reproductive outcome, potentially leading to unnecessary repeat breeding and prolonged periods of non-pregnancy. Another incorrect approach is to arbitrarily select a synchronization protocol without considering the species, breed, age, or reproductive history of the recipients. This is professionally unsound as different protocols have varying efficacy and potential side effects depending on these factors. A protocol designed for dairy cows may not be suitable for beef heifers or ewes, leading to poor synchronization, ovarian cysts, or other reproductive disturbances. This demonstrates a lack of critical evaluation and application of scientific knowledge, potentially compromising animal welfare and reproductive success. A third incorrect approach is to proceed with insemination or embryo transfer based on a loosely synchronized estrus, even if the timing is suboptimal relative to ovulation. This is professionally unacceptable as it ignores the critical window for fertilization. Inseminating too early or too late relative to ovulation drastically reduces the chances of conception. This approach prioritizes expediency over biological accuracy, leading to wasted valuable genetic material, semen or embryos, and a failure to achieve the intended reproductive outcome, which is a breach of professional responsibility to the client and the animals. Professional reasoning. Professionals should approach recipient synchronization by first gathering all relevant data on the recipient population. This includes historical reproductive performance, current health status, and any previous synchronization attempts. Next, they must select an appropriate, evidence-based synchronization protocol that is validated for the species and production system. This selection should be informed by the latest research and Theriogenological guidelines. Implementation requires meticulous attention to detail, including accurate administration of hormonal treatments and precise timing of insemination or embryo transfer, based on the chosen protocol and ongoing monitoring of reproductive status. Continuous evaluation of the protocol's effectiveness and adjustments based on outcomes are essential for optimizing future reproductive programs. Question 19. Performance analysis shows that a client is requesting a specific diagnostic imaging protocol for their mare, believing it will reveal a subtle anatomical abnormality that is preventing conception. However, during the thorough reproductive examination, the veterinarian identifies a clear, significant anatomical variation in the mare's cervix that is the most probable cause of her infertility. The client remains insistent on pursuing their initially requested imaging protocol, stating it is the only way they believe the problem will be identified. How should the veterinarian proceed? Option A. Recommend an immediate, aggressive surgical intervention for the cervix without further discussion, as the client's insistence suggests they are willing to pursue drastic measures. Option B. Explain the significant cervical anatomical findings in detail, discuss their direct impact on fertility, and propose a management plan based on these findings, while gently but firmly explaining why the requested imaging protocol is not indicated and may be misleading given the current clinical picture. Option C. Inform the client that their understanding of reproductive anatomy is incorrect and refuse to discuss the matter further until they consult with a reproductive specialist. Option D. Agree to perform the client's requested diagnostic imaging protocol to appease them, hoping it might incidentally reveal the cervical issue or provide some other useful information. Correct answer is B. Explain the significant cervical anatomical findings in detail, discuss their direct impact on fertility, and propose a management plan based on these findings, while gently but firmly explaining why the requested imaging protocol is not indicated and may be misleading given the current clinical picture. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a discrepancy between a client's perceived need and the veterinarian's clinical judgment regarding the reproductive anatomy of a mare. The client's insistence on a specific diagnostic or treatment path, potentially based on misinformation or personal bias, creates an ethical dilemma. The veterinarian must balance client autonomy with their professional responsibility to provide evidence-based care and avoid unnecessary or potentially harmful interventions. The mare's reproductive health and welfare are paramount, and decisions must be guided by sound veterinary principles and ethical considerations. Correct approach analysis. The correct approach involves a thorough and honest communication with the client, clearly explaining the findings from the reproductive examination, including the specific anatomical features observed and their implications for fertility. This approach upholds best professional practice by prioritizing the animal's welfare, adhering to the principles of informed consent, and maintaining transparency. It aligns with the ethical obligations of a veterinarian to provide accurate diagnoses and recommendations based on scientific evidence, as expected within the framework of veterinary practice and professional conduct. Incorrect approaches analysis. One incorrect approach involves proceeding with the client's requested diagnostic or treatment without adequately addressing the anatomical findings. This fails to uphold professional responsibility, as it may lead to unnecessary procedures, financial burden for the client, and potential harm or distress to the mare. It also undermines the veterinarian's role as a trusted advisor and could be seen as a failure to provide competent care, potentially violating ethical guidelines regarding due diligence and professional judgment. Another incorrect approach is to dismiss the client's concerns outright, without a detailed explanation of the veterinary findings. This can damage the client-veterinarian relationship, leading to distrust and potentially the client seeking advice elsewhere, possibly from unqualified sources. Ethically, it demonstrates a lack of respect for the client's perspective and a failure to engage in collaborative decision-making, which is crucial for successful animal care. A third incorrect approach is to recommend a highly invasive or experimental procedure based solely on the client's request, despite the anatomical findings not strongly supporting such an intervention. This disregards the principle of do no harm and could expose the mare to significant risks without a clear benefit, violating ethical standards of responsible veterinary practice and potentially leading to adverse outcomes. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive and accurate assessment. Following this, open and empathetic communication is key. The veterinarian should clearly articulate their findings, explain the anatomical variations observed, and discuss their implications for the mare's reproductive potential. This explanation should be tailored to the client's understanding, avoiding overly technical jargon. The veterinarian should then present evidence-based treatment or management options, discussing the risks, benefits, and expected outcomes of each. The decision-making process should be collaborative, respecting the client's ultimate choices while ensuring those choices are informed and aligned with the animal's best interests and established veterinary standards. If the client's request is not medically indicated or potentially harmful, the veterinarian must ethically and professionally explain why, offering alternative, appropriate solutions. Question 20. Governance review demonstrates a need for enhanced competency assessment in theriogenology diagnostics. A veterinarian is presented with ultrasound images of a mare's reproductive tract. The images reveal a dominant follicle measuring 45 mm on the left ovary, a thin uterine wall with minimal endometrial echogenicity, and a relaxed uterine tone. Based on these findings and a thorough understanding of the mare's estrus cycle, what is the most accurate interpretation of the mare's reproductive status? Option A. The mare is in destrus with a functional corpus luteum. Option B. The mare is in anestrus with inactive ovaries. Option C. The mare is experiencing luteolysis with declining progesterone levels. Option D. The mare is in estrus preparing for ovulation. The correct answer is D. The mare is in estrus preparing for ovulation. Explanation. Scenario analysis. This scenario presents a professional challenge in a clinical setting where a veterinarian is tasked with interpreting ultrasound findings in a mare. The challenge lies in accurately correlating the observed uterine anatomy with the mare's reproductive status within the estrus cycle. Misinterpretation can lead to incorrect breeding recommendations, suboptimal fertility outcomes, and potential financial losses for the client. The veterinarian must possess a thorough understanding of the dynamic changes in the uterus throughout the estrus cycle and be able to apply this knowledge to real-time diagnostic imaging. Correct approach analysis. The correct approach involves a systematic evaluation of the uterine endometrium and myometrium, considering the presence and characteristics of follicular and luteal structures on the ovaries, specifically identifying endometrial edema, uterine tone, and the presence or absence of a corpus luteum are critical indicators. A thickened, edematous endometrium with increased uterine tone, in the absence of a corpus luteum, strongly suggests the mare is in estrus. This aligns with the physiological changes of the estrus cycle, where hormonal influences, estrogen, cause these uterine alterations in preparation for ovulation. This approach represents best professional practice by adhering to established diagnostic protocols in theriogenology, ensuring accurate assessment of reproductive status and guiding appropriate management decisions. Incorrect approaches analysis. One incorrect approach would be to solely focus on the size of the largest follicle without considering the uterine response. This is a regulatory and ethical failure because it neglects a crucial component of estrus cycle assessment. The uterus provides vital corroborating evidence of hormonal influence. Ignoring it can lead to misdiagnosis, such as mistaking a dominant follicle in anestrus for one in estrus, resulting in inappropriate insemination timing and reduced conception rates. Another incorrect approach would be to assume the mare is in destrus simply because a corpus luteum is present, without further evaluating uterine characteristics. This is a failure to apply comprehensive diagnostic principles. While a corpus luteum indicates progesterone production, the degree of endometrial edema and uterine tone can still provide nuanced information about the stage of destrus or even the presence of luteolysis, which is essential for precise timing. A third incorrect approach would be to disregard the ultrasound findings altogether and rely solely on behavioral estrus signs. This is a significant professional and ethical lapse. While behavior is a component, it is not always reliable, and ultrasound provides objective anatomical and physiological data that is indispensable for accurate diagnosis and management in theriogenology. Relying solely on behavior can lead to missed ovulations or mistimed inseminations, impacting reproductive efficiency and client trust. Professional reasoning. Professionals should approach such scenarios by integrating all available diagnostic information. This includes a thorough history, physical examination, including rectal palpation of ovaries and uterus, and diagnostic imaging ultrasound. The decision-making process should involve 1. Identifying ovarian structures, follicles, corpus luteum, and ovulatory structures. 2. Evaluating uterine characteristics, endometrial echogenicity, edema, uterine tone, presence of fluid. 3. Correlating ovarian and uterine findings with the known physiological changes of the estrus cycle. 4. Considering any behavioral observations. 5. Formulating a diagnosis of the mare's reproductive status. 6. Recommending appropriate management strategies based on the diagnosis. This systematic, evidence-based approach ensures accurate diagnosis and optimal patient care, adhering to the ethical and professional standards expected of a diplomate of the American College of Theriogenologists.